Good afternoon, everyone. My name is Matus from the Pascua Yaqui Tribe Office of Emergency Management. It's been quite some time since we've put out a video, so we'd like to give you some information today. Just for everybody's reference, we'd like to speak about COVID and the flu, upcoming flu season. So just so everybody can remember, there is no national emergency declaration for the United States concerning COVID anymore. That was lifted. There is no tribal emergency declaration either. That was lifted. But we still ask people to remember that, there are different variants out there now. So if you're feeling sick, please stay home. If you feel you need to wear a mask or have another employee wear a mask, you can do so. And all tribal directors, remember, it's your prerogative, depending upon the contact with other employees or the public, if you would like them to have masks as they enter your department or your building. And I'll let the rest of the panel introduce themselves as well. Thank you.
Good afternoon, this is Dr. Renteria. As Andre said, we haven't talked to you in a little bit, so I just wanted to do a brief update on the current COVID situation. So today is September 4th? 5th? Yeah. 2023. So things change every day. So as of today, the most common COVID variant, about 70% of cases throughout the United States, is very aggressive in infecting people, but it's not causing serious illness in those that are basically healthy. For those that are immunosuppressed and elderly above 65, immunosuppressed meaning with a chronic disease, or if you're on any cancer treatment, you're still in a high-risk category for any of the variants. So for those folks, if you still want a booster or you haven't had one, we still have them here in the nursing department. You can call and get your booster, which is the one that's already been out there. For the current variant, there is no new booster for that one. The booster that exists or that might be put out is slightly different than the one we have, but the CDC and the federal government has not decided yet to release it. Or as soon as we know that they're going to release it and how it's going to be rolled out, we will put out information so people know. But it's not available right now. As Andre said, even for those that are not high risk, I think if you still want to be careful wearing a mask, even when you go, especially in crowded areas like stores or things like that, is probably a good idea. But in general, if you get infected with this new variant, most of the time it's just sort of cold symptoms, things like that. But again, that's not true for those folks that are above 65 and have a chronic disease. You can still get a serious infection in your lungs and your heart can get inflamed. So be careful, all right? And again, as soon as we know anything more on the new booster that's released, we will let the tribe know to roll our media outlets and let you know the schedule of how that will be handled in our nursing department. I also want to introduce you to one of our nurses, a nurse Kristin Kuri-George, and she's going to give you a little update on how we're going to be rolling out the flu vaccine. Kristin.
Hello, I'm Kristin. We now have the flu vaccines available here in the health department. You are welcome to come, walk-ins, you can make an appointment either way. The vaccines will be available in our regular community health department Monday through Friday, 9 a.m. to 4 p.m. And the general phone number for that is 879-6119 if you have any questions concerning the flu vaccine at all. Specialty Clinic has walk-ins on Thursdays between 2 and 4:30 p.m. or by appointment as well, and the number is 879-6120. Center Spirit is available Monday through Friday, 9 a.m. to 4 p.m. And also New Beginnings is available from 6 a.m. to 11:30 a.m. With the vaccine as well. We encourage you to get vaccinated. September and October are the ideal months to get vaccinated, just so that they're effective by the time the flu season starts. All right, thank you.
Okay, thank you for listening. I'm going to hand it back to Chief Andre Matus Sr. and something that Kristin and I forgot to address that you still want to talk about.
No, I don't think so, but since it's been a while, thank you both for being here. We really appreciate it. And folks, thanks for tuning in. And remember, just be safe and, make it a personal choice, whatever you choose to do, whether it's wear gloves, social distance, wear your mask, sanitize, all those kind of things. Please be safe out there. Thank you.